My name is Ward Blanchard. I'm CEO and founder of the Blanchard Institute and human service professional for nearly 20 years. I think it's important for families to understand that our recommendation and our information is backed up by evidence-based research and data. It's not just psychobabble or throwing darts up against the dartboard or let's stick our thumb up in the air, backed up by solid evidence and research, especially when our understanding of long-term prognosis and success. Because any treatment center that tells you a specific success rate is lying to you, because we haven't figured that out yet. Because what defines a success? If somebody goes through a treatment spectrum and stays sober and stable for a period of time, but then relapses and then stays sober the rest of their life, is that a success? Or if they go through a treatment spectrum, relapse right when they get out, and then stay sober the rest of their life, is that a success? We haven't learned to define success yet, so we don't know how to calculate it. But there is one demographic we know very well: doctors, lawyers, pilots, nurses, those individuals responsible for public safety that struggle with mental health or substance use disorders. They have to enter in diversion programs, and they're monitored rigorously. They're forced to comply with treatment, and they're monitored and drug tested for 5 years. And we know that at the end of 5 years, that 90% are sober and stable, 90%. And over here in the general population, the informal success rate is about 7 to 14%. And that is a travesty, because it shouldn't be. I can create the same treatment plan for the licensure professional as I can the general population, same exact one, except one will have a 90% success rate and one will have a 7 to 14%. The only controllable difference is family. And let me explain. Many of you may think that's because they have a high-priced career over their head, but that's not true, because the same success rate is true for the dental hygienist and stewardess that make far less than the neurosurgeon. Same success rate is true, 90%. It's because the diversion program forces the patient to comply. They don't care if the patient thinks they have a problem, is motivated, or if the family thinks they have a problem or is motivated. You have to comply with long-term treatment, 90% success rate. And over here in the general population, and let me first say, as unfair as it is, because the healthcare system is not set up to help you and not set up to support you, I'm entirely dependent on educating the family with enough information, enough support, and enough resources that they understand that they should put down boundaries long enough, consistently enough, to force compliance for a year to 18 months, for neuroplasticity, the brain healing for that long, in order to provide the best prognosis. And let's just be honest, 18 months of consistently, day in and day out, putting down the appropriate boundaries, oftentimes by yourself, gets overwhelming and exhausting. Families get treatment fatigue. It's very understandable and very human 6 months in to take your foot off the gas on these boundaries. Just say, I'm tired of going to these family support meetings. I'm tired of these boundaries. I'm tired of this recovery conversation, and just pull your foot off the gas on these boundaries. That's why the most common reoccurrence rate we have is after 6 months, because it's very understandable and very overwhelming if you're doing this by yourself. That's why at the Blanchard Institute, we really take it apart on ourselves to walk beside the family. It's still going to be difficult. It's still going to be unfair. And in a healthcare crisis, this is our reality. And so we are going to have the uncomfortable conversations, but that's our duty. The most important thing for you to understand is you're not going to have to do this alone, as we walk beside you in this journey, helping you understand the boundaries you need to put down. Because after all, our long-term goal is for your family to be happy and healthy, more connected in the long run.